welcome to the deep dive. Today, we're looking closer at something really vital for horses, their vision. I mean, think about it. A horse's eyes are just incredible.
They really are. Almost 360-degree view, great night vision.
Yeah, and it's so fundamental for their safety, how they navigate just being a horse.
It truly is. It's their main way of sensing the world, essential for, spotting danger, moving around confidently.
But here's the twist. Examining a horse's eye. It's actually surprisingly complex, not just a quick peek.
No, definitely not.
Because they have that flight response, right?
Right.
And the eye itself is so delicate, so the whole exam becomes this, sophisticated process.
Exactly. It's a real diagnostic journey. It takes skill, patience, and understanding the horse's behavior, too. It goes way beyond what you might think.
So that's our mission today. We want to unpack the systematic, really meticulous methods vets use to check out a horse's eyes.
You're going to hear about the special tools, the step-by-step where they do it.
And what they can learn, right? Diagnosing everything from maybe a simple irritation to really serious diseases that could affect vision or even their general health.
Yeah, you'll see how these experts get a deep understanding, pretty quickly sometimes. It turns what looks like a simple glance into a real aha moment of assessment.
Okay, let's start at the beginning, the foundation, getting ready for the exam. You mentioned the horse's nature, so preparation must be key.
Oh, absolutely paramount. You can't just walk up and shine a light. Appropriate restraint is first.
Like sedation.
Often, yes. Gentle sedatives like ditomidine or xylazine, maybe butorphanol, just enough to help them relax and stand still. It's safer for everyone.
And if a horse is particularly difficult?
Well, sometimes a twitch might be needed, the lip restraint. It can help focus them. And then local nerve blocks around the eye are really common.
To numb the area specifically.
Exactly. It desensitizes the eyelids and the surface of the eye, makes them comfortable without heavy sedation, crucial for a detailed look.
Makes sense. So the horse is calm. What about the toolkit? I'm guessing it's more than just a pen light.
Oh, much more, yeah. A pen light's okay for basics, but you really need a good, bright, focused light source.
Like what?
Things like a Fenoff transilluminator give a really strong beam, or even just a bright headlamp, which is great because it leaves your hands free.
Right, hands-free is good. And magnification.
Yep, essential. Loupes are common. They're like little binoculars you wear. They give maybe 2.5 to 4 times magnification, let you see tiny, tiny changes.
Wow, things you definitely miss otherwise.
For sure. And then you have ophthalmoscopes.
Okay, what's the difference there?
Well, a direct ophthalmoscope gives you a really magnified sort of keyhole view of the very back of the eye, the fundus.
Detailed but narrow view.
Right. And then the indirect ophthalmoscope, that gives you a much wider panoramic view, great for seeing the whole picture, relationships between structures.
Sounds quite involved. And I mentioned there are special drops too, solutions.
Precisely. Topical anesthetics are vital. Proparacaine, tetracaine. They numb the surface so the exam isn't uncomfortable, especially if the eye's already sore.
Okay. And you mentioned finding ulcers.
Yes, that's where fluorescein stain strips come in. They are absolutely routine. You apply the dye, and if the top layer of the cornea, the epithelium, is broken, it stains bright green.
So it highlights any scratch or ulcer.
Exactly. Even tiny ones you'd never see otherwise. It's a real game changer.
And what about dilating the pupil to see inside better?
For that, we use mydriatics. Tropicamide 1% is a common choice. Works pretty quickly, maybe 15-20 minutes, and wears off in like 4 to 6 hours.
So convenient timing.
Yeah, it's practical. Atropine sulfate 1% also dilates, but vets use it carefully. It lasts a lot longer, sometimes days, and there's a small risk of colic because it can affect gut motility.
Good to know. And saline, just for cleaning.
Yep, saline flush is always handy for rinsing debris or excess stain.
Okay, what else is in this essential kit? Any other crucial tools?
A few more things, yeah. Schirmer tear test strips to measure tear production if you suspect dry eye.
Is dry eye common in horses?
It's actually pretty rare, unlike in dogs, but you still need to check sometimes. Then there are tonometry devices. Tonopen or Tonovet are common brands.
Those matter.
The pressure inside the eye, intraocular pressure, or IOP, super important.
Why is that?
Well, high pressure means glaucoma. Low pressure can often mean uveitis, especially in acute cases, so it's a key diagnostic measurement.
Got it. Anything else?
Just the basics. Cotton-tipped applicators, sterile gloves, gauze pads, and sometimes a special catheter for flushing the tear duct, the nasolacrimal duct. It adds up to quite a setup.
Okay, so the horse is prepped, the toolkit's ready, now the real detective work starts. But you said it doesn't begin up close?
That's right. The very first thing is observation from a distance, hands-off assessment.
What are you looking for then?
You know the horse's environment first. Is it dusty, really sunny, lots of flies around, things that could be causing irritation? Then you look at the horse itself. Facial symmetry.
Checking for nerve issues. Drooping.
Exactly. Any asymmetry, like a droopy eyelid or ear, could signal nerve damage. And the position of the eyeball itself. The globe. Is it sticking out? That's exophthalmos, or sunken in ophthalmos.
And you can start checking vision from afar too. How?
Yep, through reflexes. The menace response is key. You make a quick hand motion towards the eye. Carefully, no air puff.
To see if they blink or pull back.
Right. It tests the whole pathway, seeing the threat, processing it, and the nerve telling the eyelid to blink. Then there's the tracking response, just seeing if they follow a moving object.
What about nerve-specific reflexes?
There's the palpegal reflex. You gently touch the skin near the corner of the eye, medial or lateral canthus, and they should blink. That checks cranial nerves 5 and 7 sensation and motor control for the blink.
Okay. And the pupil response?
That's the pupillary light reflex, the PLR. Shine a bright light in one eye, look for the pupil to constrict, both in that eye, the direct response, and a little bit in the other eye, the consensual response.
Is it obvious in horses?
You know, it's often more subtle and maybe incomplete compared to, say, a dog or cat. But it still gives good information about cranial nerves 2 and 3, the optic and oculomotor nerves.
Any other useful reflexes?
The dazzle reflex can be surprisingly helpful. Just a quick blink when a very bright light hits the eye. Even if the cornea is cloudy, a dazzle tells you there's at least light perception happening.
And just watching the horse's behavior for signs of pain? What clues are there?
Big ones are squinting. We call that blepharospasm or excessive tearing, epiphora, sensitivity to light, photophobia, obviously rubbing the eye.
What about discharge?
Yeah, you characterize that too. Is it clear, watery discharge, thick and mucousy, pus-like, purulent, or bloody? Each suggests different things.
You mentioned something surprising about eyelashes.
Ah, yes. It's subtle but useful. Normally, the upper eyelashes stick out almost straight, perpendicular to the cornea. If they're pointing downwards, kind of drooping, that can be a really good indicator of pain or the eye being pulled back or eyelid issues. It's a neat little clue.
And for overall vision?
You might do a simple maze test. See how they navigate obstacles, sometimes covering one eye than the other, to assess vision in each individually.
Okay, so after all that distant observation, the vet moves closer to look at the external structures.
Exactly. Now we get hands-on, starting with the eyelids, the palpebrae.
Looking for?
Swelling, cuts, lacerations, any hair loss. And importantly, looking for common masses. Things like sarcoids, which are skin tumors, squamous cell carcinomas, a type of cancer, or melanomas, especially in gray horses.
And the eyelid position itself?
Yes, checking for entropion, where the eyelid rolls inward, causing lashes to rub the cornea, or ectropion, where it rolls outward. And just watching them blink, can they blink completely? That's vital for spreading tears and protecting the eye.
What about the pink tissue lining the lids?
That's the conjunctiva. You gently pull the lids away slightly to check it, looking for redness, hypoemia, or swelling, which we call chemosis. Also checking for little bumps called follicles or any foreign material hiding in there.
And the third eyelid, I know that's quite prominent in horses.
Very important structure, the nictitating membrane. You check its position, look for swelling. Masses again, squamous cell carcinoma is common there, or if it's protruding more than usual.
What does protrusion mean?
It can be a sign of pain the eye retracts, pushing the third eyelid out, or it could mean the whole eye is sunken in ophthalmos, or in some cases it can even be a sign of tetanus.
Wow. Okay, and the tear system, the lacrimal system, how is that checked?
Tears are crucial, so we look for excessive tearing, epiphora, first. Then we check if the nasolacrimal duct, the drainage tube, is open.
How do you do that?
The Jones test is common. Put fluorescein dye in the eye, the same stuff used for ulcers, and watch for it to drip out the nostril. Should happen within a few minutes if the duct is clear.
And if it doesn't show up?
Then you suspect a blockage. You might try flushing the duct, irrigation, either flushing saline down from the eye opening, the puncta near the eye, or sometimes flushing retrograde upwards from the opening inside the nostril, trying to clear any debris.
Right. Okay, now we're moving inside, looking through the cornea, the front window. What should that look like?
Ideally, perfectly clear. Smooth, shiny, like glass. You're looking for any problems, like edema that makes it look hazy or bluish, means there's fluid buildup.
What else?
Foreign bodies, maybe a tiny splinter stuck in it. Or vascularization, new blood vessels growing across it. That's usually a sign of chronic irritation or injury.
And this is where that stain is really key.
Absolutely indispensable for the cornea, that fluorescein stain, because it sticks only where the protective outer layer, the epithelium, is missing. So, boom, you see a bright green spot, you know there's an ulcer,
Even small ones?
especially small ones. They'd be invisible otherwise. Just need to remember that really deep ulcers might only stain around the edges if the very deepest layer is still intact. Oh, and sometimes we use rose bangle stain too. That helps assess the tear film quality.
You mentioned a gray line earlier.
Yeah, a subtle detail at the limbus, where the clear cornea meets the white sclera. There's often a faint gray line medially and laterally. It marks where the pectinate ligaments attach part of the drainage angle inside the eye, important for fluid outflow and pressure regulation.
Okay, moving past the cornea, into the space behind it, the anterior chamber.
Right, the space between the cornea and the iris. Normally, it should look empty, just clear fluid, the aqueous humor.
What are signs of trouble there?
You might see blood, that's hyphema,
Yep.
or pus, which is hypopyon, or, really importantly, flare.
Flare. What's that?
It's a haziness you see when you shine a very narrow, bright beam of light through the aqueous humor. It means there's extra protein and cells floating in there, a sign of inflammation inside the eye, like uveitis. It's like seeing dust motes in a sunbeam. That's the Tyndall effect.
Very subtle. Then the iris itself, the colored part.
Inspecting that for any color changes or abnormal lumps or masses melanomas can occur on the iris too. And you assess those unique structures horses have.
The corpora nigra.
Exactly. Those black, sort of grape-like clusters along the upper edge of the pupil, they're normal, help shade the pupil a bit. But you check for cysts on them too. And you look for signs of inflammation like synechia.
What is synechia?
There are adhesions, like the iris might get stuck to the lens behind it, or sometimes even the cornea in front, really restricts pupil movement, a sign of significant inflammation.
And the pupil itself.
Assessing its size, shape, symmetry between the two eyes. And like we said, dilating it with tropicamide is usually essential now to get a good look at everything behind it.
Right. Deeper still. Into the lens and the posterior segment, the back of the eye. What about the lens?
Needs to be clear for vision. So you're looking for any opacities. Those are cataracts. They can be small or large, present from birth, or develop later due to injury or inflammation, like uveitis.
How do you spot them easily?
Retroillumination is great for that. You use the light reflecting off the tapetum at the back of the eye. It shines back through the lens. And any opacity in the lens shows up as a dark silhouette against that bright reflection. Also checking its position. Is it where it should be, or has it shifted, luxated, or subluxated?
And the jelly filling the eye, the vitreous humor.
Check its clarity. Looking for blood, signs of inflammation, vitritis, or floaters, little clumps floating around which can affect vision.
And then finally, the very back layer, the fundus.
Yes, the fundus. This requires dilation and an ophthalmoscope. It includes the retina, which is the light-sensing tissue, the optic disc, where the optic nerve leaves the eye, the choroid, the blood vessel layer underneath, and the tapetum.
The shiny layer for night vision.
That's the one, the tapetum lucidum. It's usually this amazing iridescent green, yellow, blue layer behind most of the retina. It reflects light back through the retina, amplifying it for night vision.
What are you looking for back there?
You examine the optic disc carefully, its shape, color, margins. You scan the retina for any signs of detachment, bleeding, inflammation, or degeneration. Same for the choroid. The indirect ophthalmoscope is often preferred here, remember. Gives that wider view, even though the image is upside down and backward. Helps assess the whole area efficiently.
Wow, that's an incredible amount of visual inspection. Are there key measurements vets take too?
Absolutely. Measuring the intraocular pressure, IOP, using tonometry is critical. We talked about that.
Right, for glaucoma or uveitis.
Exactly. You apply topical anesthetic, gently touch the tonometer to the cornea, get a reading. Normal is usually around 17 to 28 millimeters of mercury. And remember to keep the horse's head up to avoid falsely high readings.
Okay, and tear testing.
The Schirmer tear test, STT. That little paper strip in the lower eyelid to measure tear production. Useful if you suspect dry eye, KCS, though again, it's not super common in horses. Normal is usually over 15 millimeters of wetting in a minute.
Any other diagnostic aids?
Sure. If there's corneal disease, you might take samples for culture to see what bacteria or fungus is growing, or cytology, looking at the cells. For complex cases, you might use electroretinography, ERG, to test retinal function, or B-scan ultrasound.
Ultrasound for the eye.
Yeah, it's really useful if the front of the eye is too cloudy to see through, like with a severe edema or blood. Ultrasound lets you visualize the structures inside, like the lens and retina, even when you can't see them directly.
So pulling it all together, all these detailed steps, the observations, the tests, how does this help pinpoint the actual conditions?
Well, each finding points towards certain diagnoses. That fluorescein stain directly diagnoses corneal ulcers and tells you how deep they might be.
Okay.
Seeing signs like pain, the squinting, the constricted pupil, maybe that flare in the anterior chamber, that strongly suggests equine recurrent uveitis or moon blindness.
Which is a really serious one, right?
Very serious. Chronic inflammation inside the eye causes a lot of pain during flare-ups and over time leads to things like cataracts, glaucoma, even blindness if it's not managed properly.
And the other things you mentioned earlier.
The exam helps diagnose straightforward conjunctivitis or eyelid lacerations and trauma. Looking closely at the eyelids and third eyelid helps spot those tumors, squamous cell carcinoma, sarcoids, melanomas. Assessing the lens, clarity finds cataracts. Measuring IOP diagnoses glaucoma. Examining the fundus reveals retinal detachment or optic nerve diseases. It all connects.
Yeah, every single step from watching how they blink to looking deep inside provides a piece of the puzzle.
Exactly. It's that systematic approach that allows for accurate diagnosis.
We've certainly covered a lot of ground, or maybe I should say look deep into the equine eye today. It's really clear that a thorough eye exam in a horse isn't just, a quick check. It's almost an art form.
It really is. It takes that patience, the right tools, and a deep knowledge of their specific anatomy and potential problems.
And doing it right is absolutely essential.
Crucial. For getting the diagnosis right, choosing the best treatment, and ultimately doing everything possible to preserve that horse's sight and keep them comfortable. Without that detailed, systematic approach, so much could be missed.
It really makes you appreciate the level of detail involved. So here's a final thought for you to consider. We talked about how sensitive horses are, that flight response. Thinking ahead, what kind of advancements, maybe in tech or even just in handling techniques, do you think could make this whole vital process even better? Maybe less stressful for the horse while giving vets even more insight. Something to mull over.